Hi, I'm Dr. Ranjani Rao, practicing dental surgeon and implantologist from Electronic City, Bangalore. Sometimes a patient requires that more than 2/3 of their teeth need to be either restored or replaced. In that case, we call it full mouth rehabilitation. While most people have problems just in one or a couple of teeth, it could happen that a patient has lost an entire set of teeth on one arch or the complete set of upper and lower teeth. In that case, we have to treat the entire mouth as a single entity and restore function, restore the vertical height that the patient has lost, as well as give them teeth that they can function with. This is called full mouth rehabilitation. It's an extensive procedure, requires multiple specialties to work together in order to give them a solution, usually takes a prolonged period of treatment time, which could vary from 6 months to 12 months.